This ointment is used to treat and prevent diaper rash and other minor skin irritations, such as burns, cuts, and scrapes. It forms a barrier on the skin to protect it from irritants and moisture. It can be applied as needed, usually after each diaper change. This ointment should only be used on the skin. Make sure to follow the directions on the product packaging or as directed by your doctor. If you have any questions, don't hesitate to ask your doctor or pharmacist. Be careful to avoid getting this ointment in your eyes. If it does get in your eyes, be sure to wash them out with plenty of water. If you are using the spray, remember to shake the container well before each use. You should start to see the effects of this ointment within 12 hours. If your condition worsens, doesn't improve, lasts for more than 7 days, or comes back after a few days, be sure to inform your doctor. If your doctor has prescribed Boudreauxs ointment for you, it means that they have determined that the benefits outweigh the potential side effects. Most people who use this medication do not experience serious side effects. However, if you do notice any skin irritation, it's important to let your doctor know right away. Although it is rare, a very serious allergic reaction to this ointment can occur. Seek medical help immediately if you experience symptoms such as rash, itching or swelling, especially of the face, tongue, or throat, severe dizziness, or difficulty breathing. It's important to note that this is not a complete list of possible side effects. If you notice any other effects that are not listed, it's advisable to consult your doctor or pharmacist. In the US, you can call your doctor for medical advice about any potential side effects. You may also report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can call your doctor for medical advice about side effects and report any side effects to Health Canada at 1-866-234-2345. Before using Boudreauxs ointment, make sure to inform your doctor or pharmacist if you have any allergies. This ointment may contain inactive ingredients that could cause allergic reactions. If you have a skin infection in the affected area, be sure to consult your doctor or pharmacist before using this product. If you are pregnant or breastfeeding, it's important to talk to your doctor before using this medication. It is unknown if this ointment passes into breast milk, so it's essential to consult your doctor before breastfeeding. It's important to be aware of potential drug interactions with Boudreauxs ointment, as they can affect how your medications work or increase your risk for serious side effects. Make sure to keep a list of all the products you use and share it with your doctor and pharmacist. Always consult with your doctor before starting, stopping, or changing the dosage of any medicines while using Boudreauxs ointment. If this ointment is swallowed, it can be harmful. If someone has taken too much and is experiencing serious symptoms like passing out or difficulty breathing, it's important to call 911 right away. Otherwise, you should contact a poison control center immediately. In the US, you can call your local poison control center at 1-800-222-1222. Residents of Canada can call a provincial poison control center for assistance. Make sure to keep up with all medical appointments and follow-up visits. It's important to check your baby's diaper often and change it whenever it seems wet or dirty to help prevent diaper rash. Boudreauxs ointment is used to treat and prevent diaper rash and other minor skin irritations. It forms a protective barrier on the skin to help seal out wetness and irritants. This ointment is typically applied to the affected area after each diaper change. It is best to apply a thick layer to the affected area, especially at bedtime or any time when exposure to wet diapers may be prolonged. Remember to wash your hands before and after applying the ointment. Make sure to check the storage instructions on the package of Boudreauxs ointment. If you have any concerns about how to store it, be sure to ask your pharmacist for guidance. Always keep medications out of reach of children and pets. Do not dispose of Boudreauxs ointment by flushing it down the toilet or pouring it into a drain unless specifically instructed to do so. When the ointment reaches its expiration date or is no longer needed, be sure to dispose of it properly. You can consult your pharmacist or local waste disposal company for the best way to do this. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.